Hello, my name is Haegyun Kim. This is for lower limb, especially distal part of the lower limb. Ultrasound application part 2. We reviewed the upper limb and lower limb proximal part and head and neck earlier. So this will be the ultrasound application of the distal lower limb. This is my disclosure. So distal lower limb, we can approach from the anterior compartment or medial compartment or lateral compartment or posterior compartment. So when you take a look at the lower limb, if you approach the anterior side, you can see anterior tibialis, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. And then also you can see the deep peroneal nerve and anterior tibial artery. Medial compartment, you can, if you approach from the medial side, you can see Gastrocs, Soleus, Flexor digitorum longus, posterior tibialis. Sometimes you can see Flexor hallucis longus when you scan the little children. And lateral compartment is a peroneal muscles, the peroneus longus, peroneus brevis, or sometimes we call the fibular muscles. And then we also can see superficial peroneal nerve. And posterior compartment, you can see popliteal muscles, gastrocs, soleus, flexor digitorum longus, hallucis longus, and posterior tibialis, and tibial nerve, and popliteal angle, posterior tibial artery, and fibular artery. So this is just cartoon for the axial view of the lower limb and distal part. So this is a tibia, this is the fibular, this is the anterior compartment, this is the posterior compartment, this is the medial, and this is the lateral. So anterior tibialis, extensor digitorum longus, peroneus longus brevis, soleus, and gastroc. But underneath soleus gastroc, you can see posterior tibialis, and above the fibular, you can see flexor hallucis longus. Above the tibia is going to be flexor digitorum longus. Between that, you can see posterior tibialis. Anterior part of the lower limb. Now this is the tibia tubercle. I draw the line from the tibia tubercle to ankle, about 1/10 of the distance from the knee. You can, if you scan here, you can see tibial side here, anterior tibialis, extensor digitorum longus, peroneus longus. You don't have extensor hallucis longus yet. And then anterior osseous membrane and posterior tibialis. Posterior tib, anterior tib, EDL, peroneus longus. For us to understand anterior tibialis and then peroneal muscle nerve supply, I like to go over the fibular nerve or peroneal nerve. So the sciatic nerve run down biceps, femoris, long head and short head, and it's gonna split just above the knee into a tibial nerve and common peroneal nerve. Common peroneal nerve is smaller and it runs laterally, and tibial nerve is gonna go in the middle of the calf. And then when common peroneal nerve is gonna be on the top of the fibular head, it's very close to skin here, fibular on the skin, which is the fibular head area. But underneath the fibular head, when you pass the fibular neck, it's gonna split into deep branch and superficial branch. Deep branch goes to the front of the leg to be deep peroneal nerve to help the ankle dorsiflexor, so dorsiflexion, and superficial branch, which is gonna run on the fibular. So this deep peroneal nerve or deep fibular nerve is gonna go through the hole in between tibia and fibular before interosseous membrane started. So this is the common peroneal nerve. When it passed in between the tibia and fibula, there's a hole. It goes to the anterior part, and then superficial peroneal nerve is gonna run on the fibula. So common fibular nerve, which is common peroneal nerve, moves laterally to the fibula from above the knee. And then fibula, when it comes to the fibula neck, it will be underneath of the peroneus longus, and it's gonna split into two nerves. One become deep peroneal nerve, the other one become superficial peroneal nerve. Common peroneal nerve enters peroneal tunnel, which I explained that in between the tibia and fibula, there is some hole before interosseous membrane started. It passed that hole and it goes to the anterior part of the leg, and it runs together with the anterior tibial nerve on the top of anterior interosseous membrane. And then distal 1/3 from the knee to ankle, it will be in between the anterior tibialis and extensor hallucis longus on the top of the interosseous membrane. At that time, the tibial deep peroneal nerve is going to be lateral to the anterior tibial artery. And at the ankle, deep fibular nerve or deep peroneal nerve will be in between extensor hallucis longus and extensor digitorum longus tendon. And then the nerve is going to be medial to the tibialis or anterior tibial artery, I'm sorry. Then it's a little different at the ankle area. So if we look at this video, and then this is the fibular, and this is the peroneal muscles, you can see there is a superficial peroneal nerve, and then the peroneal nerve is next to the anterior tibia or lateral to the anterior tibial artery here, above on the top of the interosseous membrane underneath of the extensor digitorum longus and anterior tibialis. So, but if you can see here, anterior tibialis artery, lateral to that, this is the deep peroneal nerve, and this is the superficial peroneal nerve. So here we go, superficial peroneal nerve, deep peroneal nerve, and anterior tibial artery. So now I'm scanned down to the 1/3 down from the knee. You can see bigger anterior tibialis. Now extensor digitorum longus, underneath is extensor hallucis longus. Underneath extensor hallucis longus, actually there is the anterior tibial artery and then deep peroneal nerve. Anterior tibial artery, deep peroneal nerve, peroneus longus underneath is a superficial peroneal nerve. And then this is, I'm injecting the toxin, Nerve Stimulator Guidance. So as you can see, on the top of the interosseous membrane, lateral to the anterior tibialis, there's deep peroneal nerve running here. So 3 finger breaths down or in the middle, 1 finger breath from the tibia. You can put the needle and then let's see. And if this is a motor nerve to the anterior tibialis, you can see dual deflection and inversion of the ankle. There's no toe movement, but you were able to see dual deflection and inversion since I was in the motor nerve to the anterior tibialis from the deep peroneal nerve. And then this is the extensor hallucis longus. Motor point is gonna be in the middle, about next to the anterior tibialis. Well, sometimes it works, sometimes it doesn't work. Let me go back and then come back. Interesting, this time it's not working. So, but when I put the needle, it was working, but anyway, I'm sorry. Here I show you, you put the needle, this is the anterior tibialis, right? And next to anterior tibialis, you put a needle and you can see big great toe is moving. Whatever reason it doesn't want to work. So I'm going to go to the next slide. So let's take a look lateral part of the lower leg. So from the fibular head, lateral malleolus, 1/3 distal and 2/3 distal. We usually get the motor point of Peroneus longus, 1/3 distal. Peroneus brevis is 2/3 distal from the knee. And then this is the ultrasound findings, fibular, peroneal muscles, fibular, peroneus longus, brevis, and soleus. And then I'm doing injection without the ultrasound guidance, but 1/3, I'm looking for the motor point. You can see peroneal nerve, eversion of the foot. That is a peroneus brevis. And then now I'm approaching the calf muscle from the medial part of the distal leg. So my probe is the medial part of the leg. And then the proximal part, which is this one, skin, and the adipose tissues underneath. So this is the proximal, which is the tibia here. Distal here is the left side, right? So this is the gastro, this is the soleus, this is the flexor digitorum longus. But underneath is going to be posterior tibialis. You just imagine. So this is the tibia here. The left part of the screen is the here's gastroc. Gastroc is almost done because it's almost middle of the calf. Gastroc is finishing. Soleus is big. Soleus is here, right? Tibia. Very first muscle is the flexor digitorum longus. As you go deeper, which is the soleus, as you go away from the proximal is going to be the gastroc. So tibia, my probe is here, right? Tibia, flexor digitorum longus, which looks triangle shape, soleus and gastroc. And the underneath of the flexor digitorum longus and tibia, we call the chair muscles here. Chair muscles. And then this chair muscle, we call that posterior tibialis. You can see also tibia and fibular. And then above the fibular, it's going to be flexor hallucis longus. If you want to do injection to 3 muscles, put the needle here. You can hit the soleus, flexor digitorum longus, and posterior tibialis. When you have the shorter needle, you can approach posterior tibialis from the anterior. But if you have a long needle, you can approach posterior tibialis from the medial side. You put the needle right next to the tibia and muscle, in between tibia and muscle, but just next to the tibia, and you're gonna hit the soleus, flexor digitorum longus, and posterior tibialis. And this is the video. I'm doing injection to posterior tib, plantar flexion inversion. My needle is here. You are seeing my needle was here, right? In the middle, just next to the tibia and straight parallel with the tibia, you can hit, see, parallel with the tibia, your needle has to be parallel with the tibia, flexor digitorum longus, posterior tib. Don't twist your needle when you put the needle from here. It's going to be out of plane. And then we're going to take a look at the video from the place where we put the probe. This is the child leg. So you can see a lot of structures in the posterior part of the leg. And as we learned that, this one is actually the probe was flipped over. So this time tibia is the left side of the screen. So tibia, away, you are putting the probe here, right? Tibia, After then, triangle muscle was a flexor digitorum longus. Underneath the chair muscle was the posterior tibialis. And then very top was the soleus and gastroc. Here, but you see some more muscles, right? And the flexor hallucis longus, tibial nerve. So between the triangle, this triangle, flexor digitorum longus, flexor hallucis longus, above the fibula, right? So your home base is tibia and fibula. This is the square bathtub muscle, looks like a bathtub. This is the posterior tibialis, central tendon. And then this is the posterior tibial artery, fibular artery, tibial nerve. And this is the anterior tibial artery and anterior tibialis. Let's take a look. Were you able to figure it out? So I'm going to go back to the beginning. So let's start to study again. So your home base always tibia and fibula. Between tibia and fibula, we have posterior tibialis, bathtub muscle. Looks like a bathtub. So we call the bathtub muscle. Where when you approach from medial side, sometimes it's chair muscle. Adult, we cannot see this part. So only we see this part. So we call the chair muscle. Bathtub muscle usually when we approach from the posterior part, but this is the child leg. So you can see medial and posterior part. So this triangle is the FDL, flexor digitorum longus. Bathtub muscle is the posterior muscle, posterior tibialis. And then on the top of the fibula, it's going to be flexor hallucis longus. Lateral to the fibula is the peroneal muscles. Above posterior tibialis is going to be soleus and gastrocs. So here, I'm going to stop here. Tibia, more clear, right? Tibia, fibular, triangle, which is close to the tibia is flexor digitorum longus, and then posterior tibial artery, and then this is the fibular artery, because the posterior tibial artery, fibular artery is split from the popliteal artery, and then above the fibular, the muscle is the flexor hallucis longus. Between the tibia and fibula, above the interosseous membrane, this looks like a square. This muscle is the posterior tibialis, or some people say this is the bathtub. It's a bathtub muscle. And on the top of these three muscles, it's going to be soleus and then gastrocs. Now, what is this muscle? Flexor hallucis longus next to the fibula is going to be peroneal muscles. What is this round one? Anterior tibialis. And this one is the anterior tibia. Artery and anterior tibialis, okay? So I'm going to run again. Look at this. Now I'm moving, and then fibular artery, flexor hallucis longus, peroneal muscles, soleus. Then I'm going to scan up. Look at this. It's going to be merged. The two arteries going to be merged to be a popliteal artery here. Did you see? I'm now scanning down. Scanning down, and then posterior tibial artery, fibular artery is split, and central tendon of the posterior tibialis, and then bathtub muscle. I'm down very much. I'm scan up again, and then look at these two arteries. They're gonna meet together to be a popliteal artery soon. Here we go, popliteal artery. We are in the very proximal part. Okay, I hope that you guys understood. Medio-posterior lower limb. This can be only possible, mostly very thin leg or children's leg. Adult leg, only we can see this type of picture when we approach medially, but the children is so thin, so you guys are able to see this whole different muscles when underneath of the one probe. Now I'm gonna show same picture, but more, I draw the cartoon to clear for you to understand this all the muscles. So this is a gastroc, right? This is the gastroc. And next is a soleus. This is a soleus. And this is the flexor digitorum longus, which I always saying the triangle muscle. And then this is a square bathtub muscle in between two bones, posterior tibialis. And then flexor hallucis longus. Then peroneal muscles, right? Then this is the posterior tibial artery. This is a fibular artery. These two artery was origin from the popliteal artery. If you scan up, they will be merged to be a popliteal artery in the proximal part. And then this is going to be anterior tibial artery, and this is the anterior tibialis muscle. This is the next to posterior tibial artery is going to be tibial nerve. I hope that you thoroughly understood these findings. And then just to make sure that this is the posterior tibialis, flexor digitorum longus, flexor hallucis longus. In between two muscles underneath is going to be posterior tibialis, just like this. Flexor digitorum longus, flexor hallucis longus. And this is the tibialis posterior. If we remove these two muscles, only in between the tibia and fibula is going to be posterior tibialis muscles. Okay. This is artery. I just drew the cartoon. I hope that you guys understand. Let's start with the abdominal aorta. I'm going to explain about the femoral artery, which supplies the whole legs, anterior and posterior. So abdominal aorta here, and is splitting into common iliac artery, and common iliac artery is split into external iliac artery and internal iliac artery. Internal iliac artery become obturator artery and inferior gluteal artery. But interesting enough, external iliac artery pass over the inguinal ligament and it become common femoral artery. Now, after it passed the inguinal ligament, it become common femoral artery. And after common femoral artery, it's gonna split into deep femoral artery and superficial femoral artery. But before it split into deep and superficial femoral artery, it gives 4 different arteries. One is superficial circumflex artery. Second one is superficial epigastric artery. Third one is the superficial pudendal artery. The fourth one is deep external pudendal artery. After common femoral artery gives 4 arteries, then it's going to split into deep and superficial femoral artery. Deep femoral artery is going to be medial circumflex artery to femoral head, lateral circumflex artery, but lateral circumflex artery is going to split in 3, ascending, transverse, and descending, ascending, transverse, and descending. And then deep femoral artery is going to keep going down to knee area, but when they go down, they give 3 penetrating artery to adductor magnus. It supplies adductor magnus, but superficial femoral artery going through the adductor canal, and then it gives the adductor longus brevis. This all the adductor muscles will be supplied by superficial femoral artery through the adductor canal. After the adductor canal, it is going, this superficial femoral artery is going to go through the adductor hiatus to go to posterior part of the leg. At that time, once it passed the adductor hiatus, the superficial femoral artery name changed to popliteal artery in the posterior leg. But before it give past the adductor hiatus, it gives a descending genicular artery to the knee joint and saphenous artery, articular branches. And then let's go to review femoral artery again. So, okay, let's start with the abdominal aorta, common iliac artery, and common iliac artery become internal iliac and external iliac artery. Internal iliac artery splits into two, become inferior gluteal artery and obturator artery. External iliac artery is more important for us because it's going to be outside of the pelvis when it passes over the inguinal ligament, and then it becomes common femoral artery. So when common femoral artery, which means it's going to be deep femoral artery and superficial femoral artery, but before it become deep and superficial, it gives 4 branches, and then these 4 branches will be superficial circumflex, superficial epigastric, superficial pudendal, and then deep external pudendal artery. After common femoral artery gives 4 arteries, then they're going to split it into deep femoral artery and superficial femoral artery. Deep femoral artery is going to supply femoral neck, which is medial lateral circumflex artery and descending artery. The lateral femoral circumflex artery, it's going to be like a transverse and lateral and then descending, and it continues down to adductor magnus supplies supplies of adductor magnus via 3 penetrating arteries. I'm sorry, there is typo. And then superficial artery runs down via adductor canal, and it's gonna enters into adductor hiatus to go to the posterior part of the leg. At the time, superficial femoral artery name changed to popliteal artery once it goes to posterior part of the leg. So before superficial femoral artery enters the adductor hiatus, it gives a descending genicular artery, and it gives saphenous artery and articulating arteries. Now, the superficial femoral artery past the adductor hiatus, it becomes popliteal artery, right? Popliteal artery name will be changed after it passed the popliteus. Once it passed the lower margin of the popliteus, it's gonna split in 2. One become anterior tibial artery because it's gonna go to the anterior part of the leg through the hole in between fibular and tibia here and become anterior tibial artery. Then once it gives anterior tibial artery branches, it's going to go underneath of the soleus and it's splitting into the posterior tibial artery and fibular artery. Before this segment, before they split, after they pass the popliteus, we call the tibio-fibular trunk. And the posterior tibial artery and fibular artery is going to split. You saw already through the video, we were scanning around here, right? Fibular artery is going to go to more flexor hallucis longus area. Posterior tibial artery is going to be next to the flexor digitorum longus and above the posterior tibialis. Okay, popliteal. Let's review one more time. Once the superficial artery passes adductor hiatus, it becomes popliteal artery. And the popliteal artery goes down to lower margin of popliteus. We call that popliteal artery. Once it passes the lower margin of the popliteus, then it's going to split into anterior tibial artery and posterior tibial artery. And anterior tibial artery is going to go through the space between the tibia and fibular, and it's going to be on the interosseous membrane. run through the interosseous membrane, and then popliteal artery continue to run down. After it gives the anterior tibial artery, it splits into posterior tibial artery and fibular artery right after tibio-fibular trunk. Anterior tibial artery runs over the interosseous membrane, and posterior tibial artery runs underneath Gastrocs and Soleus. Okay, now let's review posterior part of the lower leg. And same video, and then we're gonna review one more time. Gastrocs, Soleus, flexor digitorum longus, flexor hallucis longus, posterior tibialis, posterior tibial artery, tibial nerve, fibular artery, flexor hallucis longus, peroneal muscles. This square is going to be basta muscle, which is posterior tibialis central tendon. Now flexor digitorum longus, and then this, look at the posterior tibial artery and fibular artery. When I scan up, these two arteries going to merge to popliteal artery. Now I'm scanning up. I'm moving too fast, but look at this two artery. Now it's going to merge it to here, popliteal artery. You guys see it? This is just splitting at this point. Very good. I hope that you guys understood. You guys can play again and again and then practice on your own leg or your partner's leg. Okay, now I put the patient on the prone position. Popliteal fossa, I draw the line to the Achilles tendon. Lateral gastroc, medial gastroc, soleus, and then this is the tibia and fibula. Therefore, in between tibia and fibula is going to be posterior tibialis. It's very hard to see the flexor digitorum longus and flexor hallucis longus here because this is very proximal 1/3 is going to be harder for you too. Those muscles didn't start yet. Okay, now I'm scanned down, it's in the middle so you guys can get to see everything. Medial gastroc is getting smaller, lateral gastroc is smaller, it's gonna disappear, right? And then soleus, and then since this is the medial gastroc, this is gonna be tibia side. This is lateral gastroc, this is gonna be fibula. Bone shadow, so flexor hallucis longus. I don't see flexor digitorum longus because it's a large adult leg, so I couldn't put all the muscles like a previous video, the pediatric leg. We can see everything but adult leg. We cannot see all of them. So flexor hallucis longus, posterior tibialis, but we don't see flexor digitorum longus here. As I said, this is the lateral gastro, medial gastro, but you can see tibia, fibular. So I increased the depth, so I was able to see, once again, adipose tissues, medial gastro, almost in the middle of the leg, lateral gastro. Because the gastroc is so small, so I know this is after the middle point of the distal leg, and the underneath is soleus. And then above the tibia is going to be flexor digitorum longus here. Above the fibular is going to be flexor hallucis longus. And then in between two tibia and fibular, looks like a bathtub, right? We call the bathtub muscle. This is the posterior tibialis. You can see this is the tibial nerve. This is the posterior tibial artery. This must be fibular artery. So I draw the bathtub here. So now I am very proud of you guys that you understand the bathtub muscle from the posterior leg. Bathtub muscle is what? Posterior tibialis. When you scan the leg from the posteriorly when you scan the leg. Very good. And I'm gonna go next. This is the video. I'm gonna show flexor hallucis longus. This is my needle connected to the nerve stimulator. This is a fibula. And the flexor hallucis longus is moving, right? Okay, I'm sorry. So we finished here. So I'm gonna take a picture. We were here in the video. I'm gonna go to the picture to name all the muscles. Okay, so this is the tibia, this is the fibular, and then this is the posterior tibial artery, this is the fibular artery. Okay, tibia, fibular. In between bathtub muscles, posterior tibialis, right? The next to posterior tibial artery is what? Tibial nerve and bathtub muscle, posterior tibialis coming. And then above the tibia, above the tibia and posterior medial side was what? Flexor, digitorum, longus. And then lateral to the tibial nerve, fibular artery above the fibular is a flexor, hallucis, longus. Flexor, hallucis, longus. Above these three muscles, this is the soleus. Soleus. Above the soleus is gastroc, medial gastroc, lateral gastroc, and then this is peroneal muscles. Then my needle was coming through the medial gastroc, soleus, and flexor, hallucis, longus. I hope that you guys understood this whole structure when you scan from the posterior distal leg. Okay, now this is the last slide, and then I'm doing injection without the ultrasound, but nerve stimulator guidance. As we know that gastroc motor point is proximal 1/3 this area. So I put the needle in the proximal 1/3 and looking for the motor nerve, which is the tibial nerve to the gastrocs. Okay, you can see calf was contracting, but Achilles tendon was also contracting. So I mean the motor point of the tibial nerve to the gastrocs. I'm sorry that I wasn't able to show, but no toe was moving. If toe was moving, that means I'm in the mixed nerve of the tibial nerve part, not the motor nerve only. And then this is the soleus. I'm in the middle of the calf. My needle is here, which is a middle or proximal 1/3. There is a motor point for the soleus. Plantar flexion only, no toes are moving. Plantar flexion only, no toes are moving. That means tibial nerve to the soleus, but only motor nerve I was able to stimulate. So you can do, when you do the injection, you can do injection without the guidance, but as we all know, without the guidance, the accuracy falling down to 11% to 85%. So when you do injection to gastrocs or soleus without the guidance, it can be ultrasound, it can be nerve stimulator. Without them, the accuracy goes down to 85%. But when you do injection to posterior tibialis or flexor, hallucis, longus without the guidance, the accuracy goes down to 11 to 17% only. So please use guidance when you do chemoneurolysis. And when you target the deeper muscle, the guided injection is critical. I think that's my last slide. Thank you so much for listening. And as we practice more, I think we're gonna find out great ultrasound findings so we can update our slides in the future. Please review this video before you come to live demonstration on Monday, 7 a.m. Eastern time. Thank you.